You know, sometimes the biggest crimes aren't cracked open with a smoking gun, but with a simple click of a mouse. So today, let's dive into a true detective story, one that played out not on the streets, but deep inside a government spreadsheet and ended up uncovering a massive, multi-million-dollar fraud.
This phrase, it comes straight from the investigation, and it is just haunting. It really captures the heart of a crime that was somehow both huge in scale, but also completely invisible. A whole scheme built on phantom trips and, well, stolen trust.
And get this entire thing started to unravel all because of one super sharp-eyed auditor in New York. She spotted this tiny little charge, $63 for a limo ride to a dialysis appointment. But something felt off, and when she dug in a little, she found out the appointment itself was a ghost. That one $63 lie, that was the single thread that, when pulled, unraveled a whole 4-year conspiracy.
Okay, so what does a multi-million-dollar fraud scheme even look like when it's just numbers on a page? And who are the people behind it all? Let's follow the money here and see the pattern that started to show up.
So at the very center of all this were two people, Rahul Raja and Sharma Alam. They were operating a couple of limo companies right out of their home in New Windsor, New York. And for 4 straight years, they were just systematically billing Medicaid for services they never actually, or at least never fully, provided. Their whole method was this kind of clever 2-part attack. First, you have the ghost rides. These are completely made-up trips to appointments that didn't even exist. Total fiction. Then you have the other side of the coin, which was a little more subtle, upcharging. See, they'd put maybe 3 patients in a single van for a group ride, but then they'd bill Medicaid like they had given each person their own private limo. It was a classic bait and switch, but with our taxpayer money.
So, what's the grand total for all these phantom trips and fake limo rides? A jaw-dropping $3.5 million. Just to put that into perspective for you, that is enough money to pay for hundreds of thousands of real, legitimate rides for people who are desperate for them. This wasn't just some little scheme. It was a direct hit on a system that's supposed to help the most vulnerable.
But you know, this story isn't really just about the money. Behind every single one of those stolen dollars, there's a human cost. So let's talk about why this matters, about the real-world impact this kind of fraud has on the people this program is meant to serve.
Just think about this for a second. Every single year in America, 3.6 million people miss or have to delay medical care for one simple reason: they can't get a ride. That's the exact problem this Medicaid benefit is supposed to solve. For so many, it's a genuine lifeline.
The program they took advantage of is called the Non-Emergency Medical Transportation Benefit, or NEMT. And we're not talking about ambulances here. This is a service that makes sure people can get to their recurring, life-saving treatments. You know, like a cancer patient getting to chemo, an elderly person getting to physical therapy so they can learn to walk again, or a veteran getting to their weekly mental health appointment. It's absolutely crucial.
This right here really just lays out the whole conflict, doesn't it? On the left, you've got pure greed, phantom rides, inflated bills, and on the right, you have the profound human need, people who depend on this service to quite literally stay alive and healthy. Every dollar that went to the scheme on the left was a dollar stolen from the need on the right.
So, how did investigators actually connect the dots? How do you go from one weird number on a spreadsheet all the way to a pair of handcuffs? Well, let's get into the digital detective work that brought this whole thing crashing down.
So for 4 whole years, this was happening, just flying under the radar. Then, in early 2025, that first little red flag pops up. And from that moment, the clock was ticking. By October, investigators were at their front door with a search warrant, and by November, it was all over.
Building a case like this, it takes so much more than just a gut feeling. This was a massive team effort, with different state and federal agencies all working together. They were cross-referencing every bill with the actual medical records, they were analyzing GPS data from the vehicles, they were interviewing the drivers. It was a slow, careful process of weaving together a web of evidence that was just impossible to argue with.
And here's where the story gets even darker. The investigation found out they were actually paying cash kickbacks to some of the Medicaid patients. So this wasn't just about overbilling anymore. It was about actively corrupting the very people the system was designed to help, all to buy their silence.
Now, as wild as this case is, it's really just one piece of a much larger puzzle. To really get a sense of how big this problem is, we need to zoom out and look at the bigger picture of Medicaid fraud all across the country.
Okay, take a look at this number. In just one fiscal year, 2024, the United States saw $31.1 billion in improper Medicaid payments. That's billion with a B. That's more than the entire economy of some countries. It's a gigantic problem that takes a constant nationwide effort to even begin to tackle.
But the good news is there is an army of people fighting back. In that same year, Medicaid fraud control units managed to recover $1.4 billion, and they secured over 1,000 criminal convictions. It's an incredible amount of work, but it also shows you just how much of that fraudulent money is never seen again. And it is absolutely a fight worth having, because the real need for this service is only getting bigger. The legitimate market for these transportation services is projected to hit over $15 billion by 2028. That just goes to show you how many people are relying on it and why we have to protect the integrity of the system.
The original article that we drew from for this explainer ends with this really powerful thought. The entire healthcare system, but especially a program like this, it just runs on trust. Trust that your ride will show up. Trust that the bill is honest. Trust that the money is going where it's supposed to.
And all of this leaves us with one last big question. We build these huge, complex systems to protect the most vulnerable people in our society. But who's protecting the systems themselves? Well, as this whole case shows, a lot of the time, it's the unseen guardians, the auditors, the data analysts, the investigators, working quietly in the background to make sure that that trust is never completely broken.